just got laid off, so if you have any tips and tricks for a hot girl unemployment summer, let me know.
I went to work this morning and got laid off. I worked for a university clinic that was a free clinic to students, and they just decided up today that they were done with it. They weren't going to afford it anymore, I guess. So they laid me and the nurse off, which we were the only two people that worked in the clinic. So life's just throwing me some curveballs, but I'm going to make the best of it. I'm going to have faith that God's just going to put me where I need to be. Everything happens for a reason. And I'm going to spend the rest of July with my kids. Not only will I be enjoying the rest of the summer with my children, but I will be most definitely seeking new employment opportunities. So...
See, these are the things they don't tell you about the cuts that are happening in Medicare and all these fields within America right now. You're going to see a lot of layoffs happening within the medical field very, very soon, guys. Think about all the people who go to like emergency centers and then don't even have emergency rooms and don't even have insurance. And, you know, the doctors, the nurses, the people who work there, they can't turn them away because, you know, they got to care for them. But at the same time, who's going to pay for that coverage? You know, like, don't get me wrong. Yeah, free healthcare, you know, is not a true thing right now within America. But at the same time, every single job is not offering healthcare, or everybody can't afford healthcare. So now you're stripping away Medicare and stripping away free healthcare to a lot of Americans, millions of Americans. Guess where that money is going to go? It's going to come right out of the pockets from, you know, nurses. She's already preparing. And I got another video of the company, the hospital is already preparing for these cuts because they already know they're not going to be able to get people to pay for these visits. It's just what it is. It's already a very expensive field. It's already very expensive to go to a doctor and get seen. And on top of that, you're cutting away fun. Like it is about to get scary. Hit the like button, hit the subscribe button for more great content like this. Let's get to the rest of the video.
I would not have been able to become a doctor. Want to know what's crazy? That if the bill passes that is currently in place to potentially be passed, there's no possible way that I would have been able to become a doctor or many other people. See, I grew up in a family without a lot of money. I'm a first-generation doctor, first-generation person to go to college. Neither of my parents finished high school, and we did not have much money. 100% of my schooling and my school loans came from student loans, federal student loans. I had to take out a lot of money. Even if it would have been an in-state school or in the Caribbean like I went to, we would not have been able to afford it. You see, this new bill is going to cap how much we could take out in student loans. And they're doing it across the board, but for graduate education or like what I was doing, becoming a physician, it'll be capped at $150,000. That is laughable when it comes to careers such as being a vet, being a physician, being a dentist, and heck, a multitude of others. And one of the biggest problems with this is it is going to prevent a lot of extremely capable, extremely hardworking, extremely caring and wonderful people who would get those positions if they were able to take out the loans. It is going to make these careers be careers of generational wealth and something that only wealthy people could go into. There are so many other big issues that are going on, such as the block on jail.
People who are within those fields and going to become doctors, physicians, dentists, all that. Like, if you don't graduate with all this debt, it's majority the people who have generational wealth. You can't go to school without getting loans. Sit down and name me one person who can go to school without getting loans right now. Of course, you got, you know, community colleges and low funding college. Like, you have colleges that you can afford. I'm talking about doctors and going to medical school. You have to go and get the degree. You have to go to doctorate school or get your master's or whatever. You have to get certified, PhD, whatever it is that you have to get to become a doctor. What about those people? They're not gonna be able to afford it. They gotta get loans. He said it himself. He's a doctor. Shout out to him. His name is Tommy Martin, MD. Guys, check him out on TikTok. He's got his whole TikTok page. I'm sure he's on other platforms as well. He said it himself. He wouldn't be able to be a doctor if it wasn't for the loans that they are giving out, guys. $150,000. You're just scratching the surface. Like, no, you're not scratching the surface. You're probably about halfway throughout the program, guys. That's just what it is. So I just don't, it doesn't make sense to me, but let's finish the rest of this video, guys. This is crazy.
Visas, and a multitude of other things that are drastically going to impact our healthcare. I am so grateful that I was able to take out student loans. And my student debt was $450,000. Same with my beautiful wife. There's no way we would have been able to become doctors without the federal aid. We are currently in the process of aggressively paying off my beautiful wife's loans and the interest that is accumulated. Anyway, in my opinion, it is a scary time in healthcare. It is a scary time to pursue college or graduate education with these barriers on aid if they do go into effect.
You heard it, $450,000 in student loan debts, guys. And he's working on paying it off. Shout out to him. I'm sure he's got a really nice salary now that he can, work to get that paid off. But guys, this is crazy. It makes no sense. You've even got doctors and nurses who are in school right now. And because they already reached their limit, they can't even finish out the rest of their degree. Why does it cost so much? Like, if we're not going to drop the price of college to become a doctor or a nurse or whatever the case is, what is the point of cutting the funding? Like, be more specific about what roles are you cutting, because within the next couple of decades, guess what it's going to look like? We're going to be having a mass shortage of people, because people are going to be like, why would I go to school? On top of that, they're getting rid of income-driven plans. So when you don't have income-driven plans to pay back the loans, you're paying all this money. Do you know what a payment looks like on a $455,000 student loan? That's over almost $5,000, especially when you consider in the amount that they're paying. Whew, I couldn't even, boy, oh my God.
So the beautiful bill about to pass, nurses. So you know what that means. Medicaid about to get canceled, hospital about to be packed, and travel nurse money about to go up. Get ready.
I don't think it's really going to work out like she thinks it is. If I was a nurse or a healthcare professional and worked in a hospital right now, I would be scared. And I'm only going to talk about facts. And I'm speaking as a psychiatric nurse practitioner, so excuse me if I'm a little blunt. But I'm going to tell you what I used to see while working in a hospital. The biggest one that is going to eliminate a lot of patients' eligibility is requiring them to work at least 80 hours a week. Have you ever seen a person who's manic or schizophrenic and actively psychotic try to work? I'm waiting. And since you wanted to talk about the money, let's talk about it. Most of the money that travel nurses make when they're on really high-paying contracts, they come from rural hospitals. Now, what's going to happen to those rural hospitals under the new beautiful big bill?
They're going to be closed. They're going to go away. There's not going to be any more rural hospitals, because guess what? When you got all these rural hospitals, there's not a lot of income in these rural areas. So guess what? The hospitals are going to go, because you don't have the funding. People can't get seen. They're going to have to drive all the way to these major cities just to get seen. But let's let the nurse, shout out to her, man. Her name is Morgan. She's a psych MP, man. Shout out to y'all. Go check her out on TikTok. This is crazy, though.
One state alone, Arizona, is going to lose $1.2 billion in Medicaid funding. 1 in 5 patients that you have in your hospital has Medicaid. For psych, it's way more. I would say 4 out of 5 or 3 out of 5 for inpatient. No shade when I say this, but I am a nurse practitioner. This person is a nurse. That is a non-billable, non-revenue job. When cuts come into hospitals, what happens? Nurses get more patients. You get unsafe ratios. More patients are probably going to come into the hospital sicker because they're not getting regular preventative care, and they can't because they can't afford it or qualify for Medicaid's rules. I wouldn't say that this bill is a win if you work in healthcare in a hospital.
Shout out to her. She absolutely nailed it, guys. When we talk about the money that's about to be gone from this industry, travel nursing is not going to be really a thing, because you're not going to have, you're going to have a lot of people who are going to be, not having care or whatever, especially once you talk about preventative care and your daily maintenance, every single year checkups and all these things like that. Yeah, you're going to have that. But when we talk about the emergency rooms, like the actual care when people are in, really need help and they can't get help because they don't have Medicare insurance or whatever the case is, the hospitals have to get the money from somewhere. They can't just cough up money and just put it, that's where you're going to see layoffs, guys. This is what it is. Let me, you know what? Let's show you a hospital that's laying off right now. I'm tired of talking about it. Let's do it.
I feel like I'm in an episode of The Twilight Zone. I got laid off from my job last month as a nurse in an outpatient pediatric clinic, and if you were here for that, I was devastated. I loved this job. I was so proud of the work that we did, and I put my heart into it. So I was very, very upset about these layoffs. That was about a month ago. So I get a phone call today, and the caller ID has the previous hospital's name. So I answer thinking it's someone from HR. Well, it was someone from HR, but not for the reason I thought. They asked to speak to me, and I say, this is she, and she says, we were calling to see if you would be interested in a job as a per diem nurse in our outpatient multi-specialty clinic. And I did what would be the equivalent of a double take on my phone. I had to look at the caller ID, let my brain process it, and I said, I'm sorry, I'm just a little confused. What do you mean? And she goes, I have your file in front of me, and I was calling to see if you'd be interested in a position as a per diem nurse in our outpatient clinics. And I said, I am so sorry, but are you calling to offer me the job that you guys laid me off from? And she said yes, because apparently with all these layoffs, they didn't take into consideration that maybe they should keep some people around to train the covering staff. I was a little offended. I won't be taking it. I just think it was a little distasteful, for lack of a better word, and to keep things as professional as possible. But yeah, that was a very interesting phone call.
If you're wondering where I've been, well, I just got laid off from my work from home job. This was something that I absolutely did not expect nor was prepared for, so it came as a shock to me like it is to you right now. We were in a town hall meeting where they basically let everyone know that they were going to do a massive layoff. Mind you, the last town hall meeting before that, they were talking about the yearly bonuses and the salary increases, so coming from that, this was totally devastating. Their reasoning behind all this was due to the changes in the healthcare system in the government, which affected the budget, which means that they need to basically make some cuts to stay afloat. So the next day I saw that a meeting was scheduled on my calendar with HR and the AVP, which meant that I was getting laid off. It was exactly a 15-minute call, and I'm not gonna lie to you, but I felt like I zoned out during that call because I was still in denial with everything that was going on. I broke down in tears after the call, and I was just really upset. It's not like I've never been unemployed before, because I have in the past, but this time is a little bit different because it's someone else deciding that for me. Now that I've sent all the work equipment back and closed that chapter of the book, it's time to start a new journey, and that's looking for another remote job.
She says she's about to start looking for another remote job within the medical field. Like, listen, shout out to her. I hope she, best of success, best of luck, whatever case is for her in her next endeavors. But guys, they don't want anybody working remote anymore. Like, that's really a thing of the past, especially when we talk about the medical field right now. Like, I don't know. I could be completely wrong. All my doctors, all my nurses, you guys come down in the comment section below. Like, please inform me from my research, from my understanding, from what I've been digging on. It's really about to get very bad right now within the industry. Like, I could be completely wrong though, guys, because anything could happen. But this is just from what my understanding. We're talking about salary cuts. We're talking about layoffs. We're talking about full hospitals, like all across the board. And I'm not trying to fearmonger. I'm just telling you guys what is about to come right now. Because at the end of the day, hospitals run like a business. They still have to remain afloat, if not profitable. They still have to keep the business going. So guess what? They have P&L statements just like everybody else. But hey, you let me know what you think about this in the comment section below. Hit the like button, hit the subscribe button as well. Like I said, all my nurses, check in the comment section below. I will see you next video. We out. Let's go.